What's up, everybody? Don't mind the bouncing. I don't want to make a habit of doing this regularly, but sometimes you gotta multitask a little bit so you can get everything done. Okay, so I'm just on the elliptical right now, just getting some cardio in. I figured I would take a shot at trying to record a little bit while I'm doing this and kill two birds with one stone. Isolation camps. That is the topic for today. So, what does isolation camps mean? What does that sound like to you? Doesn't sound like anything good to me. Okay? But this is about quarantine for people and not necessarily with their permission. Okay? So, what am I talking about? Well, first, a couple days ago, I came across this document that I hadn't seen before, but that was I kind of stumbled upon. And let's have a look at that. All right, so the Public Health Act of the province of Alberta, okay? And this is current as of July 29th, 2020, okay? You can look this up. You can just Google Public Health Act of the province of Alberta. Okay, but I'll provide a link in the description so that you can take a look for yourself. So let's see what kind of things are being said in this document. All right, let's take a look here. We define a certificate. So it says here, authority of certificate. We define that. A certificate is authority for any peace officer to apprehend the person named in it and convey the person to any facility specified by the medical officer of health who issued the certificate within 7 days from the date of the certificate is issued. Okay? Point B. For a physician to perform any test or physical examination required to determine whether that person has a communicable disease and to detain that person at the facility for the period required to obtain the result of the examination. So, let's be clear. We have a legal document giving the authority to a physician to detain you, to perform an examination, and to keep you for as long as it takes to get a result for that examination. Okay? Point C. For any physician to treat or prescribe treatment for that person in order to render the person non-infectious with or without the consent of the person and to detain the person for that purpose. So, if you thought that you were living in a country where you had medical freedom and freedom of choice, had rights on your own body, stuff like that, let me tell you, that's not what we're living right now. And these guys have written a document. Okay, this is Alberta. This is a document that's designed, frankly, to give the government the power to just bust in, grab you, and do whatever they decide is necessary for the good of other people, whatever these clowns decide for you, okay? Now, I've been at this for a while, okay, and I've been warning that if we give up our freedoms, look, we're already seeing it. Look what's happening in Australia. It's about time that you start holding some value for the people who are fighting for your freedom. Otherwise, we're going to wind up looking like this, okay? These guys have a curfew from 8 p.m. to 5 a.m. You can't be outside, okay? Look at this. Non-essential shops and businesses to close. Cafes and restaurants can stay open for no contact takeaway delivery. Only one person from each family can be allowed out of the house to be shopping at a time. You can't leave 5 kilometers away from your house. exercise for maximum 1 hour daily. They're telling you you can't exercise for more than an hour. You must wear a mask. This is real. This is happening in Australia right now. This is Australia. This could be Canada. This could be the US. Okay, people laugh at this. Okay, people laugh. They want to make jokes. They want to share cartoons and memes. It's all fun and games, okay? Until this happens to you or somebody that you love. The government is putting this out in the open. This is public. You can look this up on the internet. You can find this. Okay, they don't talk about it. The media doesn't cover it. They don't want you to know, right? But they can put it out there, because then it's out there. And it's not like they're hiding it, but they're not exactly going out of their way to let you know what's going on, okay? We're talking about COVID, okay? Or something else, for that matter. But let's be real. This is a response to the virus. We may have people who disagree with us on how dangerous this virus is and what we should be doing to protect people and slow the spread. But this is crazy town, okay? I would like to believe that even those who oppose me on masks and, you know, on a number of the things that I discuss, I would like to think that even those people would be hugely concerned with the language in this document and what it could mean for them. All right, let's have a look here. The Lieutenant Governor and Council may do any of the following. Okay, let's go down to point C. Have a look at this. In the case of communicable disease, order the immunization or re-immunization of persons who are not then immunized against the disease or who do not have sufficient other evidence of immunity to the disease. Okay? How does that sound for you? So we're talking about a forced vaccination, obviously, right? So they do not need your permission, okay? Okay, so there's so many things, right, that are absolutely crazy about this. I don't even know where to begin, okay? So forgive me if I kind of ramble here in a disorganized way. So first of all, obviously this is, again, in response to COVID, right? Look, this disease, this virus, it's there, it exists, okay? I get it. But how dangerous is it? Come on, guys. Let's be real here, okay? We're talking about something that is, I know people hate to hear me say it. I don't care. It is accurate. I'm going to say it. This is comparable to a flu, to a cold, okay? People get sick. Man, how many cases keep going up? Hospitalizations, ICU, deaths, all plummeting, right? This is the reality of this thing, okay? But we still have a pandemic, an epidemic, and a state of emergency in a lot of places, okay? The politicians are taking full advantage. They are drunk with power. I hate to use these terms, okay? But we need to start facing the reality here. I did not write this. I did not forge this. I did not make this up. This is an Alberta-run website, an Alberta document, official, okay? This is what they're talking about, okay? When I remember seeing an article go out a couple months back where the author of the article kind of insinuated that the COVID vaccine may become mandatory to children, part of the childhood immunization schedule, okay? And I remember seeing this on somebody's page who had a fit about it, who frankly actually fully is behind the masking and is one of these jokers who constantly shares these cartoons and memes and things. about masks, making funny anti-maskers and what have you, right? Anyways, this person though happens to be very against forced forced medical interventions, right? And so she had a fit. She's like, my body, my choice, blah, 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 right? Fine, fair enough. Okay, and then somebody commented and said, don't worry, they're just talking about kids. This won't affect you at all. This was a woman who has no kids, right? And she's like, oh, thank God, right? And I have to say, I thought this was actually a very despicable dialogue, okay? I hate to throw some shade here right now, but that's what I saw out of that, okay? Because it's okay for them to force this on children, but not on me. I mean, this is the same person who calls us selfish for not wearing a mask, okay? But look, this is going to happen to everybody, okay? If they go ahead with this, they're going to be able to basically pull you, kidnap you. I mean, I know this sounds scary. I don't want to believe this, okay? Like, let's look at the language. Let's look at what we're seeing here. They'll be able to take you, detain you, take you to a facility or a camp or whatever. They're going to be able to take exams, take tests, keep you as long as they're satisfied with the results of those tests. And then, if they're not satisfied, they're going to vaccinate you, okay? Understand, this is the fastest vaccine that's ever been created. Okay, I have not even got into vaccines yet. That's coming. I'm going to get into that. You better believe, okay? But right now, I'm not going to get into detail. All I'm going to say is that this is the fastest vaccine that's ever been created. It is being created having skipped and shortened a variety of safety measures, which are already, as I will get into, insufficient as it is. And this is cutting corners on that. Okay, this is not adequately tested. This is the fastest thing they've ever made. Rushed science equals danger. Okay, and then forcing this on people against their will, that's coming. Okay, I don't want it to. I hope I'm wrong. I hope we live in a country where that can't happen. Okay, but I've been warning people that this can happen. Okay, because we have politicians taking advantage of this pandemic, and we're letting it happen by not saying anything, by not having proper discussions. We're having arguments and shouting matches on social media. We're not talking. Okay, we need to start talking to people who we disagree with and come to at least what we can agree on. And I'd like to think that forced vaccinations and isolation camps is going to be something that most of us can agree on. I hope. This vaccine has skipped animal safety trials. It is not testing on vulnerable populations who are subsequently the most vulnerable to the disease. Okay, we're not doing really testing on elderly people, on people with autoimmune diseases and other comorbidities, okay? Because when you do that, those people are at even higher risk of adverse reactions. They're not gonna do that when they're trying to get the best outcome possible, okay? And believe me, they are doing that. I will discuss that in another video, okay? But this is the reality, okay? So we're having a very, very untested vaccine. By the way, coronavirus vaccines have been attempted before. And I'll get into this as well, okay? They have always failed to produce a vaccine against coronavirus. Believe me, they tried. They wanted to create a vaccine against the common cold because think about how much money they can make on that, right? This is really not that different. It's not. Similar, it's a little worse, I would say, than the common cold, but it's not that different, okay? And they've never been able to do it. And what they have had was a lot of really dangerous reactions to that. So we're gonna talk about that in detail another day as well, okay? But this is something that you're not gonna have control over, okay? They're gonna be allowed to do this. All right, moving along. You think that once you get released from this camp, that it's over? It's not. Let's have a look. Treatment after release. Where a person is released pursuant to section 41(2)(b), the person shall comply with the treatment and any other conditions that are prescribed by any physician assigned by the medical director of the facility. Where a person who has been required to submit to treatment or comply with conditions following the person's release fails to undergo treatment or comply with the conditions, a medical officer of health may issue an order in the prescribed form to a peace officer or other person to apprehend that person and return that person to the facility. On receipt of an order under subsection 2, a peace officer or other person is empowered to arrest without warrant the person named in it and return that person to the facility. Okay? This is our life now in Canada, guys. And finally here, powers during emergency. So the minister or regional health authority may do any of the following for the purpose of preventing or combating or alleviating the effects of the public health emergency. So A, acquire or use any real or personal property. D, authorize the entry into any building or on any land without warrant by any person. Okay, so you can imagine with this emergency power, what they can do. They can just take basically any property they like and do whatever they decide is necessary to isolate or test or whatever else they decide they have to do. All right, how does that make you feel? All right, this is Canada, guys. Okay, so I know we all like to poke fun at the circus that's going on down south in the States. Yeah, up here in Canada, make pretend like everything's so crazy over there and that we're so much better. You're all being distracted by the circus that's going on down there. You're not paying attention to what's going on right here where you live. Okay? And if you think it can't happen, you're not paying attention. Okay? We're seeing this all over the world. Look at Europe. Look at the measures that are being taken to lock back down. Even after I just showed you guys in a previous video, even the WHO's coming out and arguing against that. It's still happening. Look what's happening in Australia, okay? How many of you ever heard of Australia being a tyrannical, crazy place before 2020? Well, it is, okay? And it's getting worse. And we live in Canada. What makes this so much different? Okay, you think it can happen? I'm showing you it can't. This is real. Okay, look it up, read it. I'm going to show you a clip now of conversations, and you won't believe what you're seeing. And pay attention to the way this conversation goes. Okay, the very first speaker you're going to hear is the one raising the topic and asking the questions on what the heck all this is. The second speaker is going to try to give you a mirage, okay? And he's going to try to sell you this thing as a positive and kind of dance around the question and try to, it's all like sleight of hand, okay? It's all misdirection stuff. You're going to see the way he tries to sell this to you in such a way that it sounds positive, but he kind of avoids the truth. And the first speaker will get a chance to reply, and he will bring up the fact that what this guy's saying is utter BS, and that he's not really addressing the problem, and that's before he gets cut off. So you'll see that happen as well.
The next question, the member for Lanark, Frontenac, Kingston.
Thank you, Speaker. My question is to the Premier. In my supplemental question yesterday, I asked this government if the people of Ontario should prepare for internment camps. In September, the federal government posted a call for expressions of interest for contractors to supply, provide and manage quarantine isolation camps throughout every province and every territory in Canada. These quarantine isolation camps, however, are not limited to people with COVID, but provide a wide latitude for many people to be detained. Surely this government is aware of the intentions to build these isolation camps from coast to coast. And my question to the Premier is, how many of these camps will be built, and how many people does this government expect to detain?
Question. Government House Leader.
Thank you, Mr. Speaker. It is very true that when people leave the country and when they come back in, that the province is suggesting, and the federal government, in cooperation with the federal government, we are suggesting that people isolate themselves. That has been a practice that has been very successful, not only here in the province of Ontario, but across Canada. And we will, of course, be redoubling our efforts to make sure that the people of the province of Ontario remain safe, Mr. Speaker. So if the member is referring to the fact that that one of the public health policies is that when you return from a jurisdiction outside of the province of Ontario or from another country, that you isolate yourself for 2 weeks, I would suggest that has been a good policy that has been working. In fact, this House has been doing the same thing since we came back. We are working in cohorts to make sure that the Legislative Assembly can continue to operate. That's why we have 2 separate cohorts. Mr. Speaker.
Response.
And with the cooperation of the official opposition, that is why all members of the Independents have been excluded from that cohort, because we want them to be able to participate in debate. So we will continue to do everything in our power to make sure that this House continues, but that the people of the province of Ontario and Canada are kept safe.
Supplementary question.
Again, back to the Premier. Here's the RFP, and in the RFP it uses clear language to express that these camps can be used for a broad spectrum of people, not limited to travellers. Indeed, it doesn't even mention international travellers. It's just a broad latitude of people. And I'll send over the copy of the RFP after. So your government must be in negotiations and aware of these plans to potentially detain and isolate citizens and residents of our country, in our province. So, Speaker, to the Premier, where will these camps be built? How many people will be detained? And for what reasons? For what reasons can people be kept in these isolation camps? And I'd like to have the Premier assure the people of Ontario.
Member, take a seat. The next question.
Okay, so I don't know what happens at the end there. It kind of looks like he gets cut off somehow. I don't know if his mic gets muted or what, but he just all of a sudden stops talking. And then they're like, let's go to the next question. So just pretend that didn't even happen. So, look, it's disturbing, guys, okay? I hope that you're going to, if you're somebody who's been routinely mocking the freedom fighters out there, and mocking people who are taking our rights and liberties very seriously. If you're mocking that, I hope if you're seeing this, I hope you're gonna come to a point soon, like yesterday, where you start taking this seriously. Okay, I don't know how much further this needs to go, blatantly, obviously, right in front of your eyes, before you start to say, this is crossing the line, this is unacceptable, okay? The politicians, the media, they do a fantastic job of dividing us, okay? And so, again, I've talked about this many times. We bicker, we fight, we don't listen to each other, and so time just goes on and nothing changes for us in the direction we want it to go. But they have a plan, they're doing what they're doing, okay, and they're rolling things up. So we have to start paying attention, and we got to start putting our foot down, okay, because this will get worse. If we keep saying okay and keep bending over, okay, and if we keep allowing all these ideas to go unchallenged, then they're going to go unchallenged, and they're going to keep pushing. Why wouldn't they? Okay? Guys, this is like a bully, okay? Think of it this way, okay? A bully is going to find somebody and push them and push them and push them and take from them and take from them and abuse them until they don't take it anymore. Okay? And, you know, you might be shaking your head and saying this mask thing is not an overreach over our rights. And look, it is. Okay? I'm not telling you you can't wear a mask or you shouldn't wear a mask. I'm not telling you to do that. I've never said that. If you want to wear it, wear it. The principle is that the studies show very little, if any, benefit to wearing them, a lot of problems with them. This is not good science. This is not a reason to make everybody do something. Okay? And if they can get away with making a population of people comply to something that doesn't make sense, that doesn't work, against their will, it's against your will. Okay, let's be clear on that. The majority of people who are doing the mask thing are not doing it because they want to do it. A lot of them are in the closet. They're afraid to get in trouble. They're afraid to get tickets. They're afraid to get fined. Okay? Yes, there are people who want to wear them. People believe in them. Fine. Wear them. Okay? But we have to get on the same page here because there's going to come a point where we don't have anything left. Like, I know that sounds like an exaggeration. Okay? But it's slowly but surely they're taking one step at a time. They're doing this. Okay? This is a real thing. We're talking about isolation camps. Okay? Forced vaccination. I showed you the document. What's next? Okay? So that's it. I hope this opened your eyes a little bit. I hope it gives you something to think about. Okay, you don't have to agree with everything I say, but you do need to know when these things are happening. And I hope that it gives you something to think about. And I hope it gives you I hope it changes your perspective enough to understand where people are coming from that you disagree with and have conversations with them. Because what we need to do is we need to start talking to the people we don't agree with, and we need to start coming to some common ground. Or we're gonna keep getting divided, drifting further and further apart. And I don't like what kind of outcome there can be if that happens.